Hello everyone. Today's topic is appendicitis, which is the disease of large intestine. So appendicitis is the inflammation of the appendix, which is the most common surgical condition of the abdomen. Talking about its type, it has two types: acute and chronic. Diagrammatically, you can see which I'm drawing is the cecum right now. This is the cecum part. This is the appendix, and this one is the ascending colon, the free tinea, and cecum, and this is vermiform appendix. Now, acute appendicitis, it is because of the obstruction of the lumen, inside or outside of the lumen. So fecal-lift obstruction is most common cause of appendicitis. Non-obstructive causes include the infections such as from E. coli, Proteus, Pseudomonas, etc. Diet, socioeconomic status, and hereditary are all some etiology of the appendicitis. Talking about the pathophysiology, then there is a fecal obstruction की वजह से inflammation हो रहा है. There is inflammation of the mucosal and submucosal lymphoid tissue. Secretion of the fluid intraluminally. Intraluminal, there is a secretion of fluid due to inflammation, and which leads to the intraluminal pressure का बढ़ जाना. Intraluminal pressure के बढ़ते there is a mucosal ischemia, which leads to the bacteria outgrowth. Bacteria का जैसे ही overgrowth होगा, then there will be necrosis, perforation, and therefore in some cases of the appendicitis in older age, there is gangrene and perforations type of thing. As you can see here, there is a bacteria growth. Talking about the symptoms of the clinical features, there is pain, which may be sometimes migratory, sometimes referred pain, and next is anorexia, vomiting, pyrexia with fever, and this pain, vomiting, and pyrexia in combination forms the Murphy's triad. But you should remember that Murphy's sign is found in acute cholecystitis. Murphy's triad is found in appendicitis. Talking about the bowel functions, it has constipation, diarrhea, hematuria. Sometimes there is gangrene and perforation, as I have already told you. In older ages, in elderly patients, there is gangrene and perforations due to necrosis of the cell. Murphy's triad, which is the pain, pyrexia, vomiting. Now examination, pulse rate, abdominal examination, there will be tenderness, there is rebound tenderness at the McBurney's point, and muscle guarding of the right iliac fossa. There is a Cope psoas and Cope obturator test also. Cope psoas and Cope's obturator test. The examiner, what happens in Cope psoas, the patient is light on his left side, and the examiner then extends of the patient right thigh. It causes stretching in the iliopsoas muscle. If the patient experiences pain, then the test is called positive, and it is positive in retrocecal appendicitis. If you have to check for the retrocecal appendicitis, then Cope psoas test is performed, as you can see in the image. And Cope's obturator, in this, the patient is lied in supine position, and the examiner then flexes the thigh and rotate internally, and this is positive in pelvic appendicitis. Now investigation, there is a blood test. Leukocyte count is increased in this. Urine test, X-ray abdomen for any perforation and intestinal obstruction, CT abdomen, USG abdomen. Complications of acute appendicitis is appendicular mass, appendicular rupture may be present, and sometimes abscess also forms. Now management, first is appendectomy through McBurney's gridiron incision, and Rutherford Morrison incision, Lanz incision, and paramedian incision. As you can see in the diagram, all the incisions are drawn like Gray, Darren, and Lanz. Complications of appendectomy is wound infections, fecal fistula formation, and injury to the iliohypogastric nerve, which leads to inguinal hernia.